Small changes in behavior can make a huge impact. We've seen that firsthand over the last 18 months of the pandemic.
Because people were social distancing and masking in public in order to minimize the spread of COVID, it had a dramatic effect on decreasing the spread of the flu and other respiratory viruses.
The seasonal winter surge of influenza cases plummeted to a record low. Yet when restrictions relaxed and masks started coming off over the summer, respiratory viruses exploded out of season.
It allowed a little open window for these viruses to come in and spread like wildfire in our kids.
That's the reason some experts think we could be headed for a difficult flu season. The CDC says the lack of exposure to the virus could make us more vulnerable, resulting in an early and possibly severe season, especially if folks aren't masking up or socially distancing. But it's really too early to say for sure.
I don't think it would be valid at this time to try to predict exactly what's going to happen, because so much depends upon what happens between now and December with regard to human behavior.
Rolling up your sleeve for the flu shot is the best way to protect yourself. Officials urge everyone to get the vaccine by the end of October before cases generally start to spike. Washing your hands frequently and wearing a face covering in public will also help stop the spread.
This is not the time for you to take a risk with catching the flu and getting sick enough to end up in the hospital when hospitals are already overloaded with COVID patients, because you might not get the care that you need.
Catherine Hawley, Fox 13 News.